prevent people just laughing at someone making a comment or making a point about on a serious issue like this, because the government sitting on that side of the Dáil chamber were sitting in opposition in 2007, and 2008, and 2009 and 10, saying the exact same things to Fianna Fáil, who were imposing austerity on people at that time. And I'm going to read out a few lines from Deputy Joan O'Sullivan, who in the Labour Party will vigorously oppose the medical card bill at all stages in 2008. The granting of a legal right to medical cards to citizens when they reach the age of 70 was one of the few fruits of Ireland's recent prosperity, and this age group was given. It gave them peace of mind and the chance to stay healthy and out of hospital. To take it away again is regressive, cruel and inhumane. It brought a huge outpouring of outrage onto the streets of Dublin, and that's when Fianna Fáil attempted to take the medical card off our senior citizens. We owe to all those who travel from the four corners of Ireland to the Age Action meeting in Western Row and to the Senior Citizens Parliament demonstration outside Leinster House to fight their cause in this democratic chamber. This is a generation who pay their taxes at a rate that current young earners would find unbelievable. They saved their money for a rainy day. They didn't allow themselves the luxury of changes of decor or foreign holidays. They made their own sandwiches and drank water from a tap or even a spring well. They richly deserve something back from the state. The Fianna Fáil PD government, in their wisdom and credit to them, granted an automatic medical card to all those over 70s in advance of the 2002 general election. It seems now that this was only granted for as long as it suited the government, and the same for this government. When times got tough, they were in the first batch of cuts. This was done in a budget that was, we were told, going to protect the vulnerable. On the contrary, the vulnerable are taking the brunt of the pain of the cutbacks. Deputy O'Sullivan, Joan O'Sullivan, continued, in that context, one has to question what is the intention into the future. The yearly review gives no guarantee that more and more people will not have the card removed in years to come. The principle of universal access should be retained, she quite rightly said. The Labour Party has advocated a system of universal health care since 2002, including free access to primary care for all citizens. We've got a picture of what that could do for the health of the nation and improved statistics in relation to older people since 2001. And the point, I think that's very, very important. A study published in the Irish Medical Journal in 2004 showed that access to the medical card resulted in older people visiting their GP more often, an increased uptake on the influenza vaccine and reduction in the percentage of people over 70 who had a disability. It is not unreasonable to conclude that this is a result of better access to primary care and improved management of existing health conditions. There is strong evidence to suggest that men, in particular, have better outcomes when they have a medical card, because without a card they will generally only visit the doctor when they are acutely ill than for regular check-ups and monitoring of conditions. It is quite feasible to suggest that there would actually be a saving to the overall health budget, etc. That was from our Minister, Joan O'Sullivan, attacking Fianna Fáil for attempting to cut the medical card in 2008. And it cannot be said by this government that things were different then than they are now. This government, when they went into the knocking on doors, said to people they're going to protect the most vulnerable, they're going to protect people that are on the cutting edge and the cold face of the HSE, of social welfare, of all these areas where people need the support. And what are the government doing in relation to this? They're cutting from 700 or 600 down to 500 the single for over 70s single income, and then to 900 for a couple who are living together. Now, there is one question I want to ask, and it's a straightforward question. Heretofore, we've always seen that the couple would have 1,400 and the single person would be 700, or the couple would have 1,200 and the single person to have 600. This now is bringing in a change to that and saying that a single person has income threshold of 500 and a couple 900. Now that is a big change to what has normally been the case to date, and at least that should be looked at by the Minister. In saying that, that is saying that I'm making quite clear that I'm opposed to this bill on the basis of what it's doing. For medical card holders, I think it's a very important issue for people, because this government wants to save 20 million on what they call probity. I don't know what probity exactly means for a person who seeks to have a medical card and needs a medical card. We're saying to those people who have it now that you're going to actually have a cut in your income of €144 per month if you have excess in medical needs. Because if a person is earning over 184, which is the medical card income threshold, 184, that is actually less than most social welfare payments. So in effect, what the government is saying to anybody on social welfare, that if you earn over €184 on social welfare, that you're not entitled to a medical card. That's in effect what this government is saying. That's in effect, going by the logic of that, excluding a whole layer of people who are on job seekers on 188, who are on pensions, who are on disability care, etc. So that is a huge anomaly in relation to it. Now, the medical card section have always said they would have been, given their discretion, they would have given the medical card to people who are just over that, maybe €188 or €190. But the question mark is this now going to be used as a way to say, no, you're not entitled to a medical card? And I think that's what is happening. And it's happening to people that have contacted me, and I'm sure it's happened to people who contacted other deputies and TDs in this Dáil. I have a situation where a young woman who worked in blind craft for many years, it was closed by the previous government, and they were going to sell the land, it was in Drimnagh, and she lost her job. This woman wanted to work, was an active person in her community, got up every morning and went down to Blindcraft to work. And when it was closed, she had no other option but to seek job seekers and support from social welfare. For the last 3 years, she's applied for a medical card because she's a major underlying illnesses. For the last 3 years, she's applied for a medical card, has been refused every time, and has had to reapply and appeal for the medical card, and she's got it. After the appeal, she got the card. This year, the same thing has happened. She's been refused. We've sent it back in again for appeal and review, and they've come back at the medical card section saying, we don't know, we've looked at everything, etc. So the question mark is that every year she's been refused and then given the card at some stage, and then you're asked to get more medical evidence, get more proof that you need your medical card. The same proof's been sent in every year, so where do you get more proof if you're very ill and you need that medical card? This woman could not afford the medication she's on if she does not have a medical card to support her. So this is where it's actually impacting on people, and this is where you are, as a government, trying to make your 20 million cuts in relation to it. And that means for that young woman, if she loses her medical card, any medication that she has to get, she'll have to pay for the first €144. So therefore, she's taken a cut in her income, and her social welfare income, of €144 per month. That is just outrageous. This is a cut to people's income, a cut to their social welfare income. So for this government to say they're not touching core payments of social welfare, you're cutting everywhere else, and you're affecting people's wages and their income coming in, and people who most need that and most need the care that they need at a time when they are most vulnerable, and when people are absolutely scared of their lives now that they're going to lose their medical card because of the decisions made by this government. And I think this bill is an absolute disgrace. I think the government should hold its head in shame. You did not say this on the doorstep, you're going to cut people's medical card as you're doing. That you're going to take 20 million out of the medical card system. That's going to affect people. You cannot say it's not going to affect people. Some people are going to lose it. Those people who need it are going to lose it. So this government should reverse the decision on this and not implement it. And, as I said earlier on, we know there's money in this country. The wealthy are getting wealthier. Inequality is growing between those who have and those who have not in this country.
1 minute.
And it's a scandal that this government, with a Labour Party as a member of it, are implementing these cuts on ordinary people. And I think, and I'll put to the government, that this should be reversed and not implemented.
Deputy